Welcome to Axiom Answers. My name is Dr. Eric Shoemake, and I want to talk to you today about headaches. So many people suffer with headaches in our society. I want to show you a solution that doesn't include dangerous drugs, surgery, Botox injections, and all the things that I see people getting. So, one of the biggest things I've seen people improve over the years, as working with them from a functional medicine perspective, is I've seen headaches improve. I'm talking about people that have had lifelong migraines go away. People that have had 5 headaches a week go to maybe 2 headaches a year. So I'm going to give you some solutions for that today. And if there's something you want to follow up on, I'll put the link underneath here in the comments as well. So I want to start with the types of headaches that are out there. And a lot of people get kind of caught up in this. Like, so several different things can cause headaches. So one can be TMJ disorder, so which is the temporomandibular joint, so a problem with the jaw. And I'll show you the cause of that. We'll talk about migraines. So migraines are headaches that usually include like an aura. Some migraines start at the base of the neck and they come up into the head. A lot of people get nausea and light sensitivity with those. Sinus headaches, which usually kind of start behind the eyes. Hypertension headache, that would be one from high blood pressure. That's usually a little bit different, more of a pounding type of headache. And then there are cluster headaches, cervicogenic neck headaches, tension headaches, stress headaches. But I will tell you, they all have one thing in common. All 8 of these headaches have one thing in common. And that's what I'm going to get into with you today. So if you're having any of those, first thing I want you to understand is there's no such thing as a normal headache. People that get headaches think, oh, I only have 2 or 3 a week. And it's because it's common and it might be common for you, but it's not normal. Headaches are a warning sign for the most important part of your body, which is your head and your brain. So there's no such thing as a normal headache. I've had 2 headaches in my entire life, and they were both caused by very specific things. That's normal, is to not have headaches. So headaches might be common, but they're not normal. So what we want to do is investigate the cause of those things. Because most people, when they have headaches, they'll take an Advil or, ibuprofen or Motrin or something like that. But the cause of your headache is not an Advil deficiency. Because if you get rid of the Advil wears off, what happens? The headache comes back. So we didn't fix the cause of the problem. We want to talk about fixing the cause of the problem today. So what happens in most people and so I want to talk about where the nerves in your head come from. And they actually come from your neck. So there's a nerve that's called the greater occipital nerve that starts right in here in this space right there. Okay, and that's at the back of the head, goes up, or back of the neck, it goes up into your head and it branches off. It can go to the occiput area, it can go behind the eye into your temple. So any of the nerves in your head actually originate from your neck. You don't have any nerves that originate in your head. They all originate from your neck. The top vertebra in your spine at C1. That nerve is the one that goes up and supplies the whole head. So when you have this, what's called a normal cervical curve, what we need to see when we look at you is this red line right here is there should be a curve in your neck like this. If you look at this person over here with this red line, how that's really straight, that's called tech neck. So that's from people sitting on computers too much, from your head being shifted forward, and that actually compresses this area up top and pinches that nerve that goes back up into your head. So if I pinch the nerve that goes into your head, what kind of problems do you think you're going to have? Obviously, headache would be the number one thing. So I'll show you, where these things come from, but that's called a subluxation. When your spine gets misaligned like that, that's called a subluxation. So the places that subluxations come from are going to be a few different things. So car accidents, and a lot of people come to see me after 20 years after they've had a car accident. And they're like, yeah, maybe the headache started after that, or I've had them forever. Well, these small traumas over time or big traumas can become big issues, especially with headaches. Sports injuries, kids playing sports or people playing sports. A big one is somebody sitting on a computer, like you see on this one on the right side over here. So somebody that's on a computer all the time, that's this thing called tech neck. Okay. So what happens in tech neck is your head should be on top of your shoulders here. But what happens is you see the head starts to shift further and further forward. The more we're on our phone, the more we're on computers, the more we're on laptops. And when it does that, the force on your neck when your head's on top of your shoulders is 10 to 12 pounds, which is okay. Your body is built to withstand 10 to 12 pounds of pressure, which is the weight of your head. But when your head shifts forward just 15 degrees, that doubles the amount of weight on these nerves in your neck. So it's 27 pounds. And if it goes further forward, it's 40 pounds. And some people will take an x-ray and they're up to 60 pounds of pressure. Imagine wearing a 60-pound headache or a helmet. Do you think you would have headaches after a while? Of course you would. So a lot of people don't realize that these problems are actually coming from their neck. It's not coming from their head, it's coming from their neck. And that's called tech neck. There's actual diagnosis called tech neck now, which is crazy. That's how prevalent this is. So I'm going to give you an example in a pre and post here. So I had a patient who came in to see me a while back. So this is Debbie. When she came in, you could see what's happening with her neck, first of all, over here. And this is somebody, by the way, that had been going to a chiropractor. So this is somebody who had been gone to a chiropractor called a relief care chiropractor for years. And I asked, what did your x-rays look like? And she said, oh, they never took x-rays, or they never took any re-x-rays or did any corrective care. But she had never had x-rays before. And unfortunately, that's a lot of chiropractors. So if you see what's going on with her spine here, you can see how straight her neck is. There's no curve. She has actually degenerative changes or arthritic changes, which means this has been going on for a long time. And what you're seeing here is there should be a space between this bone called the atlas and her occiput, which is her skull. But you see there's no space right here. There's almost no space. And that's pinching that greater occipital nerve that go into the head. So she had had headaches. So she would get cluster headaches and migraine headaches, about two headaches, two migraines a month, and cluster headaches 3 or 4 times a week. The migraines would knock her out. She would feel like she had to just lay with a washcloth over her eyes because any light would cause her to throw up. And she'd been dealing with this for years and years and years. And she never knew why. She was getting Botox injections. She was taking amitriptyline, which is a migraine medication, and she still had the migraine. So a lot of people don't realize there's something else you can do about this. So when she came in to see us, we took the correct x-rays. And you can see all the damage that was on her x-rays over here. And then we started correcting that. So through corrective care, which is what we do, it's much different type of care. It's pre and post x-rays. It's making sure things are corrected. So when I took my son to the orthodontist, I wanted to see x-rays that things were improving, obviously. Well, of course you would want to see that. If you're putting the time and money and effort into it, you want to see objectively these things are changing. So within about 90 days, she was doing some specific work with her spine, work on some exercises that she was doing at home. And if you look at her x-ray after that, after 90 days, you could see we actually were able to restore that curve. But even more importantly, look at the space that's here that wasn't here before. So now that nerve that's going back up into the head, the greater occipital nerve, guess what happened? That nerve is now not getting pinched. It's now functioning normally. So what happened with her? Headaches are gone. And when I say headaches gone, I mean gone. She hasn't had a migraine. These x-rays are a few years old. Hasn't had a migraine in 5 years. Migraines are gone now. She maybe gets one headache a month, like a normal cluster headache, if she's on the computer too much. So she still spends a lot of time on the computer. And her life is completely changed. And I see this in people over and over again. And I had another patient who came in recently. She had had migraines for 35 years, and I'm talking 4 or 5 a week. Guys, I can't imagine that. And we were able to do with her within about 90 days, those migraines went to like one time a month, and she doesn't get any headaches anymore. Why? Because we got rid of the cause of the problem. So the thing is, 90% of headaches are actually cervicogenic. Now, there could be other causes of headaches that are different. It could be a brain tumor or, just crazy high blood pressure or something else like that. But the rest of these headaches that I showed you on there at the beginning, they all have the same etiology. So the TMJ disorder. So the nerves in the are the muscles that attach to your TMJ, which is right here. Those muscles attach to your atlas. And if there's a problem with that bone right here, it actually pulls the TMJ out of position. So if you're having TMJ problems, I see people get better with that just by repairing the curve. Migraine headaches we talked about. Sinus headaches, guess where else these nerves go from C2? These nerves go directly into the face and the sinuses. So I've seen people with lifelong sinus headaches get better. Hypertension, your blood pressure is controlled by right here as well. And then all these cluster headaches, neck headaches, tension headaches, stress headaches, all of those things have this greater occipital nerve or the nerves at the top of your spine in common. So if you're having these problems, you don't have to just live with it the rest of your life. And you have nothing to lose and you have your health and your life to gain. So I've had so many people, I have a thing called the drug freedom trash can where we've been able to see people get off of their drugs forever because they just don't have these problems anymore, these migraine headaches anymore, these regular headaches anymore, because we got to the cause of the problem. So the bottom line here is that if you're having these issues, you don't have to have them. And then, when we look at food sensitivities and other things, which we do, we look at you as a comprehensive patient. So like maybe there's some foods that are causing some of the problems. Maybe there's some stress issues or sleep issues. When we put all of these things called the 5 essentials together, that's where we see people get well. So if you're having these headaches, don't live with them anymore. All right. There's a solution to these problems. And if you never knew the solution, you know the solution now, and you could be one of the literally thousands of people that we've seen get rid of headaches forever. So if you're having these issues, don't hesitate to reach out and get the help that you need.